Good morning, everyone. The September 6th meeting of the Cannabis Advisory Committee, Public Health and Community Impact Subcommittee is called to order. Moderator, can you please call the roll?
Good morning, and of course, but first I would like to make a quick note about today's meeting format. The Bagley-Keene Open Meeting Act exemptions expired in July of this year, so our Cannabis Advisory Committee meetings and subcommittee meetings will now be conducted in a hybrid format. This means that we welcome attendees both in person here at DCC headquarters in Rancho Cordova and virtually over WebEx. This is our first week of these hybrid meetings, and we've worked very hard to ensure a seamless transition. The most important part of these meetings is public input. So if we run into any technical glitches, please know that we're working hard to work those kinks out and we'll get you heard. So keep raising your hand. Now I will call the roll, and please answer present when your name is called. Member Bauer? Absent. Member Christensen?
Present.
Member Tupy?
Present.
And Member Woolsey?
Present.
Looks like quorum has been established.
Thank you. Good morning, members and members of the public. Thank you so much for joining us today for the Public Health and Community Impact Subcommittee. Sadly, our former chair, Dr. Ellicott Mathe, has moved to New York and is unable to continue on as a member of the CIC. I will be filling in as chair today. Our first item up on the agenda this morning is public comment on items that are not on the agenda. Moderator, can you please open the floor for public comment for items not on the agenda?
Absolutely. We are now taking public comment on agenda item number 1, which again are for items not on the agenda. If you'd like to make a comment, please raise your hand by clicking on the hand icon next to your name if you've logged into the meeting, or by pressing *3 if you've called into the meeting. For our in-person commenters, please raise your hand and our audience moderator will work with you. All commenters will have 2 minutes to speak with a 30-second warning, and each member of the public will have 1 opportunity to speak on each agenda item. So for now, if you'd like to speak on items not on the agenda, please raise your hand. Mitchell Colbert, I've just sent you a request to unmute.
Good afternoon, that you can, hope you can. So I am speaking today off topic as a member of the SB 54 Implementation Working Group. This is a first of its kind law that was passed last year, which is going to establish an extended producer responsibility system for all kinds of plastic packaging, including cannabis packaging. The first step is going to be the establishment of a producer responsibility organization. That's going to be happening next year. A lot of stuff starting next year. Right now, CalRecycle is in the informal rulemaking process, and it would be really in your best interest as a cannabis business if you joined us during the informal rulemaking before CalRecycle goes to a formal rulemaking. Right now, CalRecycle is looking for any data that could be helpful to making this a effective recycling program, something that's not going to be harmful to the industry. If you have data to pass on to CalRecycle, that's happening just until September 12th, next week. Like I mentioned, I'm on the SB 54 Implementation Working Group. You can still join that working group if you want to, or if you don't want to join, reach out to me, mitchellcolbert@gmail.com. Happy to work with you. But this is a first of its kind law in the nation. Huge step forward to help California's environment, and I just want to make sure that it doesn't also harm our cannabis business industry, because as we know, a lot of folks are really struggling out there. And while we do want to make the environment better for everybody, so this industry lasts a long time, we don't want short-term thinking. We don't want to destroy our environment at the cost of business. This is what we need to do. We need to focus on the long term, help the environment, deal with our waste issues, but in a way that also helps the business community. So please join with us, the SB 54 Implementation Working Group, help CalRecycle out, get involved in that informal rulemaking before it becomes formalized. Thank you very much. Thank you for your time today, CAC.
Thank you. All right, at this time, if you'd like to comment on agenda item number 1, please raise your hand. Joanna, I've just sent you a request to unmute.
I thank you for taking my comment this morning.
If we are going to speak about public health and cannabinoids, we really do need to speak about intoxicating hemp. That is available everywhere in concentrations that far exceed the regulated market. And one would think that this committee would prioritize this, would want to educate the public about this issue, and would kind of get on the ball. And the last several meetings, there have been numerous people who've mentioned this issue. There's been legislation, and really nothing's happening, and it's kind of disappointing. It's you're not looking in the right place to protect public health and safety, and that's really disappointing. So I'll say it again when it's time to reflect upon topics for future agenda items. And it's my hope that that this committee will go where the risk really is. And that's not the regulated market. It's the unregulated intoxicating hemp market. Thanks very much.
Thank you. All right, if there's nobody else that'd like to comment on agenda item number 1, we will close agenda item number 1, if that's okay with you. All right, the comment is closed for agenda item number 1. Thank you.
Okay, the next item that's up on our agenda today is an update from the California Department of Public Health's High Potency Think Tank. This is actually an update that I am providing today for the members of the committee and the public. So let me start off by saying good morning, subcommittee members. I am here today as a follow-up from our last Cannabis Advisory Committee meeting in June of this year. My name is Robin Christensen. I'm the chief of the Substance and Addiction Prevention Branch at the California Department of Public Health. And within my branch, we have 4 programs that address overdose prevention, excessive alcohol use, problem gambling, and youth cannabis prevention, which is why I'm here today. Next slide, please. Oh, next slide, please. So last June, we made the formal recommendation that the DCC continue to work with my team at the California Department of Public Health to convene a balanced, expert, scientific task force that is exempt from conflicts of interest. And that task force is meant to do 2 things: to review the scientific literature on the issue of increasingly high THC potency of cannabis products, and to make public health recommendations to cannabis regulatory agencies and to the public. Furthermore, we emphasize that this needs to be a priority for both DCC and for CDPH, and the goal of this work is to be completed urgently and no later than within the next 12 months. Next slide, please. So a little recap of the background on this issue. We know that use of high potency THC products may carry greater risks for adverse health events than use of lower potency products. And we also know that this evidence base here has been stronger among adolescents. When you add to that the rapid pace of emerging cannabis products and the innovation among industry, this makes public health surveillance both more difficult and also presents interesting challenges when we're communicating this information about cannabis-related risks and potency-related risks to the public. Furthermore, the research on high-potency cannabis is really just beginning to emerge. There are still gaps in our understanding of high-potency THC, what high-potency THC is, and in the type of research that we really need to be doing, including who our most vulnerable or potentially vulnerable populations are. Next slide, please. It is clear, however, that making sense of the impact of high-potency THC on public health is a complex and requires a multidisciplinary approach. And despite the fact that research is still emerging, I don't want to mislead anyone. The body of evidence does increasingly show that higher potency products are associated with increased risk of negative health effects, including anxiety and depression, acute symptoms of psychosis, and increased risk for psychological disorders and cannabis use disorders. Now, does this mean that all users who are using high potency THC products will experience these outcomes? No, that's not what we're saying. But we do know that as high potency THC use increases among the general population, or the study population that we happen to be looking at, we also do start to see some associations with increases in these really damaging diagnoses. Next slide, please. So to begin to address these concerns, we did bring together a team of scientists from a breadth of disciplines. This included public health, epidemiology, neurology, medicine, behavioral economics, policy, some of our social sciences colleagues. And we met in December of 2022. And in May of 2023, Dr. Catherine Hess, also from CDPH, presented some of these findings to the members of this subcommittee, including these 6 potential strategies that we've proposed here. Now, these are just directional strategies. There's no clear guidance from the think tank at this point on what particular regulatory prevention or policy approaches we should be taking. So think about these in terms of broad stroke strategies. The 6 strategies are taxing by THC content, setting a THC purchase limit, setting THC potency caps on products, what's known as age gating, or controlling the age at which people can purchase specific products, looking at dosing and portion control, and looking at labeling and marketing opportunities. So next slide, please. As scientists, we are always really curious about the limitations of the research, the questions that are left unanswered, and some of the nuance. I believe Dr. Hess shared these out in May, and I'm including them here because they're important to keep in mind. Most studies are still observational. Data quality, because it is emerging, that data quality on potency can be variable and hard to capture in observational studies. You can imagine that when you're surveying individuals about how high, what type of potency products they're using, their recollection can vary. And also the information on the label itself, we know has a margin of error. Research in this area is still considered somewhat emerging, and there's no current consensus on what constitutes high potency. We also know that as we start to explore the potency of a product, it doesn't necessarily equate to the amount of THC absorbed. These things can vary in either direction, meaning that some people may be more affected and other people are less affected. As policymakers and leaders who are invested in keeping the public and our consumer base healthy, however, we also have to ask ourselves, how can we best prevent some of those negative health outcomes that we presented on a prior slide? How can we prevent future unanticipated consequences that may be damaging not only to the public's health, to an individual's health, but also potentially to an industry? So to that end, I wanted to update you on our next slide, which provides an overview of our progress made working in partnership with the Department of Cannabis Control. We have completed our review of scientific literature, and I'll add here, it sounds funny for me to say this out loud because this is never a completed task. We are continuing to review emerging scientific literature, and we are adding this to our in-house repository of information on high potency cannabis. We have worked with DCC to review those 6 initial prevention and policy recommendations that were drafted by the scientific experts. And moving forward, we have 3 tasks in front of us for the future. We have been meeting monthly with the Department of Cannabis Control to plan out these next steps. In the very near future, in fact, at the end of this month, we will be bringing back together our team of scientific experts to do a deeper dive into some of our prioritized recommendations. This ultimately has the goal of developing an issue brief with recommendations for leadership, both Department of Cannabis Control and the California Department of Public Health leadership, and ultimately providing recommendations, actionable recommendations to the public. Next slide, please. Our first prioritized recommendation is to look at cannabis, labeling, and marketing. By this, we mean exploring the recent research on labeling and marketing to better inform policy and prevention strategies for high-potency THC products. In this upcoming discussion, we will be exploring our current understanding of the impact of cannabis packaging on user perceptions and their intent to use, We'll be looking at the impact of potency messages, looking at warning messages, and evaluating price strategies on user decisions. We will also be exploring an evaluation of recent label and marketing claims. We selected this as our first priority because we feel that it is actionable and reflects the urgency that was identified by this subcommittee. There's also a strong precedent for working in this area. There are parallels in both tobacco and alcohol for looking at labeling and marketing information as a way of conveying key public health prevention messages. Next slide, please. We wanted to present this information here to the members of the subcommittee and to the public in order to get your input and feedback on this recommendation prior to our meeting. We wanted to update you, and we also wanted to see if there is input from the members of the subcommittee on this agenda item and also from the public. So I am happy to entertain that now. I don't know what I'm supposed to do at this
Yeah.
point. Am I supposed to turn to you and ask you if you have any input for me?
I don't have any information. I mean, I appreciate where you're going and the information. And I would agree that labeling and marketing is probably something that's actionable. I appreciate that too. Some of the other things are probably harder to conceptualize and address. So I think it's a great first step. I'm interested to hear what the public has to say and our colleagues.
Yeah, I appreciate all the work that's gone into it to get it to this point. And I appreciate the efforts that are continuing and ongoing, and it's not just a static group, but that they're continuing to meet and look into this. I was curious, as far as the group that make up themselves, are they from all over the country, or is it primarily just California-based folks?
Yeah, that's a really good question. So we are primarily looking at California-based folks, but we are open to membership from outside of California. Sometimes that makes it a little bit more difficult with convening a meeting. The meetings so far have been remote, but even so with time zones and bringing in external partners. At the prior meeting, we did involve colleagues from University of Washington and also University of Colorado, reflecting two of the other states and the Western states that are a bit more ahead of the game in terms of legalized cannabis market. So I think that is certainly something open for discussion. As it currently stands, the members reflect California University academic researcher partners.
Thank you.
So you mentioned something about California and nationwide. Is there international research on this topic that might be more further along than ours due to our federal prohibition of actual research on what's really in the marketplace?
You know, it's an interesting question because yes, like the answer is both yes and no. There's a lot of international research, but because each of the different countries and within the US, different states have different laws, regulations, and even just patterns of use, not everything is going to be immediately applicable to the California setting. So there's some balance that we're trying to achieve by learning from the experiences of others. And when we're looking at the broad literature, we are including evidence from not just California or the United States, but also international research that can be informative. When it comes to taking actionable steps, we have made a decision to focus primarily on California-related partners in this conversation, so to inform California-related solutions.
Thank you.
Moderator, are we ready to shift to public comment, members?
I think so. Thank you.
Okay, we are now taking public comment on agenda item number 2. The topic for this comment period is displayed on the screen. If you'd like to make a comment, please raise your hand by clicking on the hand icon next to your name if you've logged onto the meeting, or by pressing *3 if you've called into the meeting. For in-person commenters, please raise your hand and our audience moderator will work with you. All commenters will have 2 minutes to speak with a 30-second warning, and each member will have one opportunity to speak on this topic. So with no further ado, Dr. Yafai, I've just sent you a request to unmute.
The work done by this committee, but as a physician on the ground and in active patient care, there's a large gaping hole in this presentation to create a really balanced perspective on policy. This youth cannabis prevention doesn't look at those in need with medical access. For example, sickle cell patients, which are often our teenagers, cancer patients in both teens, adolescents, chronic pain, autism, cerebral palsy. These policies that you are suggesting do not carve out a place for these individuals, and it further financially impacts the most vulnerable of our patients, those who are both pediatric and who are under medical need. Those create further one of the strategies that you created was increasing taxation on high potency THC, which would be fine if we were just talking about recreational laws, but what you're not doing is considering medical access, and those higher THC products are often more useful for medical patients. I have put myself out there. I know my colleague, Dr. Bonnie Goldstein, who specializes in pediatrics, has also volunteered to help and assist this group and organization, and we still have not heard back from the DCC. The groups that you are creating with individuals from the universities do not see patients with cannabis use. They never recommend cannabis out of the universities. So this is a huge gaping problem, which I've brought up over and over again.
30 seconds.
I strongly urge you to understand that your recreational laws apply both to medical as well as to recreational in this day and age to California, as they have not been carved out separately. And quite frankly, the dispensaries don't care about whether you're medical or recreational. They're doing the same for both. And lastly, please recognize that under 18 requires a medical recommendation for an individual to even walk in the door of a dispensary. So oftentimes those individuals are faking getting a medical recommendation just to walk through those doors. So this is a really important on the field, in-person issue.
Thank
so
you.
much.
Dale Geringer, I just sent you a request to unmute.
Here representing California NORML, National Organization for Reform of Marijuana Laws. Am I correct that we're commenting here on the labeling issue that you were discussing previously and not on other proposals at the moment? Well, in any case, we do think that there's a real problem with the labeling. Hear lots of complaints from users and patients about the difficulty of first even reading the dosage instructions on the typical label and getting any notion of whether a particular dosage is high or low or medium. I don't know how many people know that what 5 milligrams of THC actually means versus 10 or 2.5. And a lot of the times you can't figure out what the appropriate dosage form is, whether you take a teaspoon or a half a teaspoon or an eyedropper to get a certain amount of THC. Often you have to do arithmetic to figure that out. That's very unsatisfactory. So we do hope that you will look at the labels more carefully, which I believe is very much within the jurisdiction and mandate of DCC. And
30 seconds. Thank you. Mitch Colbert, I've just sent you a request to unmute.
Sorry about that. I hit the wrong one. Thank you so much. I missed the doctor's name who just spoke. I would like to concur with everything she's saying. As a cannabis journalist, I've interviewed Dr. Bonnie Goldstein in the past. She is so knowledgeable. She was honestly one of the pioneers of pediatric cannabis recommending She was one of the pioneers working with kids. Her and Dr. Frank Lucido in Berkeley, like the first two I can think of. So I would definitely encourage you to reach out to that doctor that just spoke and Dr. Goldstein. Real quick, just speaking as a member of the sustainability community, as an environmentalist, I just want to note the fact that, if you put a THC cap on things, if you force someone to then buy 2 products instead of 1, you have just doubled the packaging waste that has already been doubled by regulations since 2016. We are drowning in a mountain of cannabis packaging waste, and you are talking about making that even greater. So I just want to, reality check this. What matters more, the health of our environment, which is personal health, or a THC potency cap? Like, I'm not trying to say that there isn't a problem with higher potency products. We've seen that with alcohol too, with anything, with any drug. You take more of it, there's generally more negative repercussions. But that's in a recreational setting. When we're talking medicinal, many medical patients need a higher dose. Cancer patients, serious migraine patients. These are personal friends of mine who use high dose cannabis for their medical conditions. So I strongly recommend bifurcation between recreational and medical. And personally, I would advise dropping the entire topic of potency limits, because all you're really going to do is create a whole bunch more packaging waste, pollute our environment, and then make human health a whole lot worse for generations to come. Thank you.
Thank you. Pamela, I've sent you a request to unmute.
Epstein. I am the Chief Legal and Regulatory Officer for Terpene Belt. I am also proudly the President of the Board of the California Cannabis Industry Association. CCIA submitted written comments, and we appreciate the public health focus of the subcommittee and the task force. However, what is needed is not another prohibition. We know that that doesn't work by the size of the illicit market. What is needed is education and an understanding of what is intoxication. We sent you a report being produced by the U.S. Hemp Roundtable, who is seeking to have 5 milligrams outside of the regulated marketplace in hemp products. So beyond looking at what a max potency would be when we have medical patients and needs, would be to set where intoxication begins. Where do you want to see regulation? Because that is how we steward and protect public health. As the prior speaker had mentioned, you can just buy more of something. And if something is able to have THC in it outside of a regulated system, you are not able to capture and regulate that. So what we want to see is a open dialogue, communication, and the ability to truly foster a regulated industry with sensible regulation driven by available science. Thank you so much.
Thank you. Lynn Silver, I've just sent you a request to unmute.
Can you hear me?
Yep.
Good morning, Dr. Lynn Silver, pediatrician, Public Health Institute, and UCSF. First, I want to thank the California Department of Public Health for moving forward in convening a working group on looking at the issues of potency in response to the recommendation of the committee. It's incredibly important. Our market in California and in the US is compared to those of other countries, is uniquely characterized by massive proliferation of very high potency products, and also the extent of migration of flower to extremely high potencies. Other countries are building their markets differently, and we would be wise to look at that carefully. I am extremely concerned from rapidly growing body of scientific literature that this is going to be driving public health harms on a significant scale in a number of areas if it is not addressed. It is clearly a complex area and a difficult one, and one where we need to learn what the best approaches are. but failing to act upon this inexorable trend to higher and higher potency is not an option unless we want to increase severe mental health effects like psychosis and other things that are associated with potency of the products. I do concur with some of the comments of people who
Seconds.
that consumers need better information. We can prioritize that and make that part of packaging without more waste. We do need to have clear communication of dosing, and we do need CDPH to get rid of the intoxicating hemp market as well, which complicates the whole issue. There are products with 20,000 milligrams of THC. I recently found one in the hemp market. So all of those things need to be addressed. We do ask that CDPH give the work group autonomy to reach its conclusions.
Joanna, I've sent you a request to unmute.
Can you hear me?
Yes.
Thank you very much. I'd like to start by agreeing with absolutely everything that Dr. Yurfai said about medical need. A lot of these recommendations that you have made in the framing of the questions that you are attempting to answer are based on the idea that cannabinoids affect people the same way. And this is patently false. And there are high dose products that are desperately needed by people who are sick. And if you remember, this is how we got into this way back in 1996 in the first place. Secondly, I would encourage you, and again, this is an issue about framing, to speak about cannabinoids, not about cannabis. Cannabinoids are cannabinoids, whether they are derived from cannabis, whether they are derived from hemp, whether they are derived from orange peel or yeast. Cannabinoids are cannabinoids and affect the human endocannabinoid system. And so any framing about high potency products should not be limited based on source. And it's extremely important that CDPH and the DCC recognize this, advise policymakers in the legislature properly about this, also internalize this concept and start producing regulations that really do protect public health from cannabinoids
30 seconds.
that could be either too potent or produced in a manner that is unsafe for human consumption. Thank you.
Thank you. Anthony Avalos, I've sent you a request to unmute. Anthony, you are unmuted.
Can you hear me?
Now we can.
All right, sounds good. I just want to say thank you for the opportunity to speak. I want to echo the last speaker's comments. If public health is the priority of the legalization of cannabis, because the legalization of cannabis was formed for medical purposes, I want to make sure that in the pursuit of public health in the conversation, we're not forsaking access to plant medicine. And so while we cannot predetermine how a specific amount of any cannabinoid is going to impact individual endocannabinoid systems, what we can say is that we need a lot more research before we put more obstacles to access in front of people. Thank you so much, and everybody keep up the great work.
Thank you. Walker, 323, I've just sent you a request to unmute. There you go.
Appreciate the work of this committee, but as a parent and as a youth mentor, I find the issue of dosing very confusing and very disturbing. I do not understand how you can prescribe dosing or prescribe for medical issues when there's been no FDA type pharmaceutical protocols conducted. So who's setting the standards for dosing or medical prescription? From my viewpoint, I don't see any standards and wonder where they come from. So it would seem to me there really needs to be much stronger separation of medical type products and recreational type products. And the labeling needs to be very different and very clear for each one of those. As again, I'm a layman, but I find this very confusing. Thank you.
Thank you. All right, members of the public, we have, anyone else have comments on agenda item number 2? All right, I believe there are no other comments on agenda item number 2. Would you like to close this agenda item?
Yeah.
Okay, great. Agenda item number 2 is closed.
All right. The next item up on our agenda is an update on the California Department of Public Health's cannabis data dashboards. And I'm joined today by my colleague, Dr. Angela Krantz.
Good morning. Are you able to hear me? Is this on? Good morning, everyone. Thank you for the opportunity to share some of the Substance and Addiction Prevention Branch's data dashboards. As Robin shared, I'm Angela Krantz, and I oversee our surveillance and research unit. Next slide, please. Today, I'll be speaking with you about 2 dashboards. First, the Cannabis Poison Control System Calls dashboard and the California Youth Cannabis Use dashboard. Next slide, please. First, we'll be talking about the poison control dashboard. Next slide, please. This dashboard was launched in February in this year and was updated just last month with data from 2022. The data were provided by our partners at the California Poison Control System, and the dashboard presents data on the nature of calls that were managed by that system. Our branch requested data on cannabis-related calls, and we currently have access to the following data elements. First, we have information on intention, just for members of the public who may not be familiar. An example of an intentional exposure to cannabis that resulted in a call to the Poison Control Center is a suicide attempt. An example of an unintentional exposure would be consuming an edible product that contained cannabis without knowledge. So that's our intention data element. We also have information about the mode of exposure. So dried plants, edible preparations, concentrated extracts, and e-cigarettes, as well as the sex of the individual who is exposed to cannabis. Next slide, please. This slide shares an overview of our dashboard. Visitors to the website are able to parse the data by number of calls and the rate of calls per 100,000 population. In each of these tabs, there are 2 visualizations. First, a trend over time, the line chart on the left, and next, data broken out by age groups on the bar chart on the right. Next slide, please. Moving now to data highlights from this dashboard, we see a notable increase in the age-adjusted rates of cannabis-related calls to the poison control dashboard from 2016 to 2022. The percent change in age-adjusted rates over this time period was about 170%, increasing from 2.2 calls per 100,000 population in 2016 to just under 6 calls per 100,000 population in 2022. This increase is most pronounced among children 5 years of age and under, with an increase of over 400%. Followed by a smaller but nonetheless notable increase among youth and young adults aged 6 to 19. The frequencies are also available below for your review. Next slide, please. Moving now to data highlights on the mode of use, we see that primarily exposure to a cannabis edible product was responsible for calls to the poison control system. More than half of those calls could be attributed to an exposure to a cannabis edible product. This was a bit higher. This rate was a bit higher for children aged 5 years and under, as well as a bit higher for youth and young adults under 19 years of age, but nonetheless was a notable source of exposure for adults aged 20 years and older. So as you can see, each one of these pie charts indicates that about half or more than half of calls to the poison control system could be explained by exposure to an edible product. Aside from exposure to an edible, dried plants were responsible for about a quarter of cannabis-related calls, and then other modes were responsible for the remainder of those calls. Next slide, please. We turn now to disaggregation by intentional and unintentional exposure. As we saw earlier, the largest percent change in rates of calls could be seen for the youngest children, and this is especially pronounced here for unintentional exposure for children and young adults. We see unintentional exposure among children 5 years of age and younger increase about 460% during this time period, 2016 to 2022. And the percent change is only slightly lower for the age range 6 to 19 years, just under 400%. Again, we see increases among adults 20 years of age and older, but these percentages are much smaller. Next slide, please. I turn now to dashboard findings from our California Youth Cannabis Use Dashboard. Next slide, please. Thank you. This dashboard was launched in February of this year and is based on data from the California Healthy Kids Survey. This survey is administered once every 2 years and is funded by our partners at the California Department of Healthcare Services and overseen by the Department of Education. These data are representative of California students in grades 7, 9, and 11. And so moving forward, when we talk about middle school students, it refers to grade 7 students, and high school students are freshmen and juniors in high school. Visitors to the website are able to explore cannabis use by a variety of demographic characteristics and other attributes, including mental health status, use on school property, race and ethnicity, sex, and parental and guardian education. Next slide, please. This slide shares an overview of dashboard features. Again, we are able to disaggregate information by high school and middle school students. And on each of these tabs is a bar chart, as you see on the bottom right. We are able to parse the data by each of the attributes I mentioned on the previous slide, as well as stratify by use frequency. Our measures are defined as current cannabis use, using cannabis within the past 30 days, and heavy cannabis use, using cannabis 20 days or more within the past 30 days. And these measures are operationalized both within the confines of the data, the survey question, as well as consistent with previous literature and recommendations from federal agencies. Next slide, please. Turning now to data highlights for high school students from 2017 to 2019, I'd like to encourage the audience to focus on findings for 2017 to 2019 because of changes in the survey questionnaire. Data from this most recent wave are not directly comparable to prior years. And so focusing here on findings for current cannabis use, we see that just under 13% of high school students reported current cannabis use, and just under 3% of high school students reported heavy cannabis use, more than 20 days per month. Next slide, please. These data present high school student cannabis use by mental health status. We see that high school students who reported chronic sadness or suicidal ideation had higher rates of both current and heavy cannabis use compared to the general population of high school students. In the previous slide, we saw rates of approximately 13 and 3% respectively, but here we see rates hovering between 20 and 25% and approximately 5%. So we do see that they're higher here. Next slide, please. Disaggregating high school student cannabis use by race and ethnicity, we see that American Indian and Alaska Native students, as well as students who identified with 2 or more races, had higher rates of cannabis use, both current and heavy. White students also had higher rates of current cannabis use compared to students from other races and ethnicities. Next slide, please. Parsing high school student cannabis use by parent and guardian educational attainment, we see that overall, students who reported that their parents had graduated from college have substantially lower rates of both current and heavy cannabis use compared to their peers whose parents did not graduate from college. Next slide, please. We turn now to data on middle school students. And as I'm sure folks will notice as we progress through the presentation, not all indicators are available for middle school students due to smaller sample sizes. There are a comparatively smaller number of survey respondents in middle school, and not all categories are reportable here. Here we see that about 3.6% of middle school students in 2017 to 2019 reported current cannabis use, and about 0.5% were heavy cannabis users. Next slide, please. We see that the pattern for high school students in terms of mental health status does hold for middle school students, with middle school students reporting chronic sadness having higher current and heavy cannabis use compared to the general population of students. So you'll think back to the previous slide, the current cannabis use amount in the general population was about 3.6%. Here it is 7%. And in the previous slide, it was about 0.5%, whereas here it approaches 0.8%. So it is higher here as well. Next slide, please. Moving now to middle school student cannabis use by race and ethnicity, we see that students of color in middle school have higher current cannabis use compared to white middle school students. Next slide, please. Next, we turn to middle school student cannabis use by parent and guardian educational attainment, and see that on the whole, similar trends hold here, with middle school students whose parents graduated from college reporting lower levels of cannabis use compared to their counterparts with parents who did not graduate from college. Next slide, please. In this fiscal year, our branch is looking forward to launching a new dashboard on cannabis-related emergency department visits. We look forward to sharing data on cannabis burden, cannabis poisoning, abuse, dependence, and use. And so we are eager to contribute to dialogue and public information on this topic with this dashboard. Users will be able to stratify the data by age groups, race, ethnicity, and sex, similar to our existing dashboards. And we'll present 2 separate visualizations, one for youth and young adults and another one for adults. And so this will mark, although the dashboard is not released yet, we anticipate that this will mark an additional foray into our reporting on adults. Next slide, please. Last but not least, I wanted to acknowledge Shanash Safi, who is our cannabis dashboard lead, for all of her hard work in developing these dashboards. Next slide, please. And that concludes my presentation of the data from the Substance and Addiction Prevention Branch at CDPH. This is only a subset of the data that we have available. We also have several other reports on our website for your review. But I'd like to open now to questions from the committee, and then later on to questions from the public. Thank you so much.
Thank you, Angela. Members, are there any questions?
I do have a question. It relates to, well, first of all, I think this is great. Just seeing what you did, I pulled up one and I can see that it's easy to find the website and find the information for yourself. So that's really great. I appreciate that. The question I had revolves around the reporting of sadness and suicide. So there's the numbers are higher, but are there follow-up questions in the survey to get to the cause and effect. Are they using because they're sad, or are they sad because they're using? And that's a question that is kind of important when talking about potential solutions to perceived problems.
Absolutely, that is really important. Unfortunately, the data don't follow youth over time, but there are data sources available that may not be California specific, but that might be nationally representative that we could potentially use to get at that question. So I can make a note of that and follow up with you.
Thank you.
Thank you.
I would just kind of echo what's been said. This is extremely helpful to be able to drill down into the data and get a sense on what's happening, particularly around the overdose issues. I don't think I have any specific questions on it, but thank you for presenting today and for all the work you and your team are doing.
Thank you so much.
I actually have a question, and I also thank you for all the work that you and the team have done to put these together. I know it takes a lot of work to take the data sets and convert them into a public-facing, friendly, user-friendly source so that hopefully the goal is that the public and stakeholders have access to this information and can use it to drive their goals. My question for you actually has to do with one of the forthcoming dashboards that you mentioned around emergency department data. You mentioned cannabis burden, and I'm wondering what we mean by that. If you could just clarify what that means in the context of the emergency department visits.
So we have not yet finalized the measure, so can't commit to a specific operationalization yet, but generally, my understanding of cannabis burden is it refers to, say, mortality in the emergency department. And so it could be a way of better understanding the cost to the healthcare system and the cost to society in the form of excess deaths.
Thank you. All right, members, unless there's any other questions, let's go to public comment.
Okay, we are now taking public comment on agenda item number 4. The topic for this is displayed on the slide, so please keep the comments limited to this agenda item. If you'd like to make a comment, please raise your hand by clicking on the hand icon next to your name if you've logged into the meeting, or by pressing *3 if you've called into the meeting. For our in-person commenters, please raise your hand and our audience moderator will work with you. All commenters will have 2 minutes to speak with a 30-second warning, and each member of the public will have 1 opportunity to speak on each agenda item. So now as we go forward, Anthony Avalos, I've just sent you a request to unmute.
Thank you again. Great presentation. I definitely took a few screenshots because I think this is information that we all need to have. With that being said, I wanted to know, is there a data set that explains how these kids are coming into possession of cannabis in the first place? Because I don't know that they can legally access cannabis in California. If that is the case, then obviously any regulatory changes would not apply to them. So that's my first question. And then my second question has to do with either calls to poison control or visits to the ER. And I did hear you say that you don't actually have long-term studies, but I do want to know if there's any reporting on what the outcomes of either those calls or those ER visits are. If there is long-lasting medical impacts from exposure to too much THC is what I'm getting at. So just wanted to throw those 2 questions out. Thank you so much again for the presentation. It was excellent.
Thank you. Mitchell Colbert, I've sent you a request to unmute.
Thank you so much for the wonderful presentation. So, at the risk of sounding a little personal, I grew up in a house with cannabis and a handgun. I knew where it was kept, but I was also raised that those things are for adults, not children. The fact that we are seeing cannabis use rates spike after legalization, despite all products being in childproof packaging, just shows us that childproof packaging isn't solving the problem, and it's just creating a new problem of astronomically more waste, as parents just throw it out the second they get their products home. What will solve the issue of cannabis use by youth is parental education, encouraging them to be like my parents and store it somewhere locked away and tell their kids it is just for adults, like alcohol. I'd also like to ask, is California 4 times as concerned about youth exposure to pharmaceutical drugs? Last time I looked into this as a journalist, in 2016, the rate of pharmaceutical exposure was nearly 4 times as high as the rate of cannabis exposure. This is a small potatoes issue compared to pharmaceutical exposure like opioids. When it comes to middle and high school student youth use and the potential link to sadness that was mentioned, like the previously mentioned association between cannabis and psychosis, that is merely correlational at best, and no study has ever proven a causal link. Speaking as someone who began using cannabis medically in high school after being diagnosed with manic depression and the pills made me more suicidal, some of those kids might be going through mental health crises that predate their cannabis use, and they are self-medicating. I think focusing on cannabis is a green herring here. We should be investing more in youth mental health problems because as youth mental health is at a breaking point after this pandemic. I personally know families whose kids committed suicide after the isolation of the pandemic. Many children are struggling. They might be self-medicating. They need mental health programs, not criminalization. Thank you.
Thank you. Joanna, I've sent you a request to unmute.
Can you hear me?
Sure can.
Great. Thank you for putting together these dashboards, but the info is woefully incomplete. I cannot help but notice that your data do not parse out cannabinoid products derived from cannabis, which are by law required to be in child-resistant packaging, and those from hemp that are not required to be packaged in child-resistant packaging. An Insurance Institute for Highway Safety study found that California adult use cannabis outlets were avoided selling cannabis to underage customers 100% of the time. So where are youth getting these cannabis products? Well, they're getting them in convenience stores and they're coming from the hemp market. So my recommendations are, number one is to shift the framing from cannabis to cannabinoid. It should not matter what the source is. What matters is whether or not there are intoxicating cannabinoids in the final form product and who has access to them. My second recommendation is to start drilling down these time frames from 2016 to 2019, arguably. We are looking at cannabis products that are derived from cannabis. From 2019 to 2023, we are arguably looking at hemp-derived intoxicating products. And the data show this. So it's time to reflect this in the dashboard. Lastly, it's vitally important that poison control is asking for pictures of the products, and that way we can define the source, and also we can infer what type of manufacturing processes these products have gone through, whether they are coming from cannabis in the regulated market, whether they are coming from cannabis and the unregulated market, or most concerningly, they are coming from hemp and in the unregulated market and available.
Dr. Yafai, I've sent you a request to unmute.
Thank you so much. I just want to address a couple of points. Anthony Avalos, I believe, had a question about the ER visits. Just so that you are all aware, again, my background is an emergency medicine physician who's worked in the ER for about 20 years now. The ER visits are not toxic. They are accidental overdoses in pediatrics that usually don't stay longer than 4 to 6 hours. You're not talking about lethal events here. I believe in the entire country, we have had one lethal event outside of California in a child age 4. So in terms of lethality, it's essentially 0. In terms of child-proofing packaging, I strongly stand with the DCC about the child-proof packaging. It's really important, and that the problem is, and I think we've been trying to work on this, and we will continue to work on this, is that they're gummies or chocolates and they're left out by parents. This is inappropriate at best, and it requires education, because the difference between alcohol and gummies or chocolates are that you can leave out 5 chocolates or 5 gummies and somebody will eat all of them in one sitting, which is a month's worth of medicine for some people, whereas a child will not eat a whole pint of vodka because they literally just physically cannot. So it's really important to understand the differences when we point out THC versus alcohol. And to be clear, we're talking about THC, not any of the other cannabinoids. And again, it's really important to specify this as we go through.
30 seconds.
Lastly, in terms of ER visits and poison control, it is important that we keep track of this. I agree with Joanna, who also suggested that we take pictures or have pictures so we can look at exactly what the problem is. We work on this from the emergency department perspective, but the DCC has no funnel for us to communicate to the DCC. I've tried to reach out about a poisoning that we had out of my office for one of my patients, and there was nobody to help me. So the question becomes is what is DCC going to do about it once you gather that data?
Thank you. Judy Strang, I've sent you a request to unmute.
I appreciated the data presented by the California Department of Public Health. I'm the legislative vice president of a coastal council of PTAs, and I'll be providing some of the information I heard here to them. And I'm speaking in their behalf because they have two concerns, one of which has been addressed, and that our children are receiving THC through hemp products. That if they are derived from the hemp plant seem to be legal, and if they are derived and manufactured from synthetics, they are illegal. Well, that's great if somebody's doing any enforcement. And we feel that California Department of Public Health really needs to put into place some enforcement around that issue. However, what we note, although we concur with labeling, significantly better labeling and closure of the products is important. What we all notice here in the parent community is that cannabis is being sold in a retail setting. It's the largest billboard in the world, a big building that says cookies on it. One of the major sellers of marijuana products in our state, certainly here in my county. And as long as we allow our retail settings these types of titling that imply there's no danger or harm associated with the products within, we have normalized it for young people. And it is time for the DCC to take a stronger stance on what those buildings say as titling. It's a danger to our community, and it's certainly a danger to our young people. Thank you.
Thank you. Kim Homer Vargadori, I've sent you a request to unmute.
And sharing these data. I'm hoping that there is a possibility for the substance use branch to partner with the California Tobacco Prevention Program and seeing if we can incorporate more questions on youth marijuana use into the California Youth Tobacco Survey. I know the most recent survey, which has newer data than the California Healthy Kids Survey, has some good questions on marijuana, but we're able to see a lot more and understand a lot more about youth tobacco use because of the questions that ask about initiation of use, reason for using. This most recent year, we saw some really staggering new data that youth use is directly tied to anxiety and stress, which we haven't seen at the levels in the past that we are this year. So I think since the survey is going out to young people, it's a very well done survey, and we see a lot of co-use with the products. It would be great if we can just collaborate on that data collection and incorporate more marijuana questions with that, since again, it's already going out to students in schools. Thank you so much.
Thank you. Lynn Silver, I've sent you a request to unmute.
Thank you. Dr. Lynn Silver, Public Health Institute. There was the issue about whether these effects were not serious. The data on pediatric ingestions, for example, from Rady's Children's Hospital in San Diego, has shown that 50% of the children who present require hospitalization, 10% go to ICU, Nationally, we've seen increasing need for ventilation or mechanical ventilation from cannabinoid ingestions. So this is a growing problem, and it's not just on serious hospitalizations. It also comes at great cost. It is not just about child-proof packaging. It is about products, packaging, and marketing that is blatantly attractive to kids with cartoons, toy figures, anthropomorphized animals, and fruits. There are also many ER visits that are not about accidental ingestions. They are for psychosis. For example, ER visits for psychosis and delirium associated with cannabis increased by 53% in our data in a 3-year period. It is very concerning that there has been a complete lack of enforcement of the legal requirements not to be attractive to kids. DCC needs to enforce these existing requirements as well as strengthening them to prevent these. Quite honestly, it is my understanding from the data I've seen that these are problems in all 3 markets, the legal cannabis market, the illicit cannabis market, and the hemp market. They're all selling products attractive to kids and dangerous in other ways. And there needs to be strong enforcement in all 3 sectors to protect children. Thank you.
Thank you. Walker, 323. I've sent you a request to unmute.
Thank you. I just would like to ditto what the previous speaker, Lynn Silver, said. There's just no reason why marijuana products should be packaged, should look like candy or beverages or snacks or treats that appeal to children. Prop 64 promised us that we would have a safe market that would keep children safe. Well, then we should not be marketing these products directly to children. So I would also like to see the DCC take a stronger stand against this kind of packaging. And as an earlier speaker said, also retailer names like cookies that are invitational to children. I think that stopping this kind of packaging and marketing should be one of your top priorities. And I hope that you'll address that. And on another note, I'm in San Diego, and I have heard pediatricians and hospitals here say that very young child hospitalization has become a pediatric crisis here. So I think it's a bigger issue than maybe many people realize. Thank you.
Thank you. Casey, I've just sent you a request to unmute.
Presentation with the data from the California Healthy Kids Survey, and just wanted to add, as a parent, my concern about the attractive nature to young people of these products that look like Doritos and Cheetos and gummy bears. All these products are being found on our campuses. You might be, your eyes might be wide opened if you went and talked to any of the administrators of your local high school or middle school and ask them to see the bag or the box that they carry of the packaging of these THC products that they find on campuses. Our kids are getting them, they're using them, they're extremely potent, and they're doing damage to their developing brains. We hope that the DCC will take this serious and enforce the laws that were promised to the voters in Prop 64, that these products wouldn't be attractive to young people. They are. Our kids are getting them, they're using them, and they're damaging their brains. Thank you.
Thank you. Becky Rapp, I've just sent you a request to unmute.
And I just wanted to add to the conversation my concerns. I do appreciate that the DCC did take steps back in November of last year to adopt regulations that clarified what could be included in inhaled cannabis products, limiting the flavors that are attractive to children and only allowing for the true marijuana flavor to be a part of those inhaled products. Unfortunately, this was almost a year ago, and every marijuana shop in my county is still selling products inhaled products that are flavored. So my question is, how and when will we see any regulation? This is a great start to require them to be to not have flavors, yet it does not seem that there is any enforcement, and the industry is completely ignoring this new requirement. So I ask to see what can be said going forward, and what message needs to be conveyed to the
30
marijuana
seconds.
so that they are aware and will remove these products from their shelves. Thank you.
Thank you. All right, we are on agenda item number 4. If you have not commented already and would like to comment, now's your opportunity. It looks like we are no longer have any commenters for agenda item number 4. Would you like to close this agenda item?
Yes.
Yes. All right, very good. Agenda item number 4 is closed. Thank you.
All right, so here we are. We're moving on to item 5. This is recommendations for future agenda items. We have established a robust list of agenda topics at our first subcommittee meeting, but I wanted to also give members the chance to suggest any additional topics that they would be interested in discussing. So members, this floor is open for our discussion.
For me, I think that, because I feel like we kind of prioritized that list and it was fairly robust. So I think just continuing down that list, since we kind of felt those were the priority items to look into and talk about.
Yeah, I would agree with that. I have a question though for our council. And that is, there are quite a few comments related to intoxicating hemp products. And my understanding is hemp is regulated separately and outside of the space that we're working in. I just want to confirm that. So an agenda item talking about intoxicating hemp would be somewhat fruitless in this venue. Yeah. So. Yeah. All right. Thank you. And yeah, I would just stick to our priority list and hear from the public. Thank you.
All right. Thank you so much for that. And let's turn it over to the public then. Moderator, could you please open the floor for any public comment?
Yes, so we're now taking public comment on agenda item number 5, which is future agenda items. If you'd like to make a comment, please raise your hand by clicking on the hand icon next to your name if you've logged into the meeting, or by pressing *3 if you've called into the meeting. For in-person commentators, please raise your hand and our audience moderator will work with you. All commenters will have 2 minutes to speak with a 30-second warning, and each member of the public will have 1 opportunity to speak on this agenda item. Thank you very much. And with no further ado, Dr. Silver, I've just sent you a request to unmute.
Thank you. Following up on the preceding conversation, I would request that the committee request that the Department of Cannabis Control provide a detailed report to the committee on enforcement over the past, actually since its inception of the Prop 64 provisions on attractiveness to children, what has been done in relation to both product design and marketing. And second, that they report on enforcement of the September 2022 regulatory provisions and guidance on not using flavors in inhaled cannabis products. What has been done, because as one of the previous speakers mentioned, we're not seeing changes in retailers. We're still seeing these products all over the place. So it would be very helpful to have an enforcement report. Thank you.
All right, thank you. And Joanna, I've just sent you a request to unmute.
Thank you. Can you hear me?
Yes.
Great. I must say, if this committee is going to ignore intoxicating hemp-derived cannabinoids, then today has been one big exercise in if you ask the wrong questions, you will get the wrong answers. In the protection of youth and children, source is irrelevant. Final form cannabinoid, not cannabis, not hemp, cannabinoid products should be regulated. This conversation is akin to having a discussion about alcohol where vodka is treated differently than whiskey because one is derived from potatoes and the other is derived from corn. This also should not be, so I implore you to add intoxicating hemp. There's been legislation about this, and the DCC is supposed to address it. That addressing it thus far has been inadequate, and I implore you to put this on the agenda. Also, attractiveness versus accessibility. And I think it's important to recognize that something may be attractive, but if it is inaccessible to youth, then that's pretty much irrelevant. The accessibility issue is in intoxicating hemp primarily. That's where the Doritos are coming from. That's where the easily accessible products that are showing up in middle schools are coming from. So I implore you to put this back on the agenda. Don't pretend that it's not happening, because again, asking the wrong questions will get you the wrong answers and the wrong results. Thank you.
Thank you. All right, members of the public, we are on agenda item number 5. Anyone has further comment? Judy, I've just sent you a request to unmute.
Good morning. Perhaps you have it on your list from before, future agenda items. But as a person here in my county who has worked on tobacco youth surveys, I was taken with a previous caller on item 4 suggestion that we take a look at the questions there, because as she mentioned, they have added marijuana questions to the youth tobacco survey. So we are gathering information there. And this is an opportunity perhaps for this group to take a look at what's going on in the tobacco world, look at the work that they're doing now to include marijuana, because they recognize the slide across between tobacco to marijuana and from marijuana to tobacco. In fact, in our county, 30-day use for high schoolers is higher for marijuana than it is for tobacco. And unfortunately, tobacco is now rising, probably because of this very situation. The work on tobacco has been going on for over 20 plus years, and it's reflected in lower rates. I think we have a lot to learn from that work, and a nice, robust presentation as an agenda item would be wonderful. I do want to reiterate what one of the speakers said, that we have found out the return on the tobacco use survey of our youth telling us that they're smoking and vaping for stress reduction and depression.
8 seconds.
And very clearly indicating the role that marijuana and tobacco use plays in mitigating some really serious mental health problems of our young people. Thank you.
Thank you. Anthony Avalos, I've sent you a request to unmute.
I would like to, and I'm not sure if this is under the subcommittee's purview, but I would like to see what current medical research results are coming forward in California. And I would also like to see best practices around titration for medicinal cannabis use. I think that if we're going to have the conversation about restricting access to certain milligrams, we need to know who that impacts and how, right? And so making sure that we understand what is the medical need of cannabis, what is the medical need of certain milligrams, and then making sure to bring that back to the public so that we can all understand why we need protections and for who. Thank you.
Thank you. And Mitch Gobert, just sent you a request to unmute.
Hi there. Thank you all so much for the presentation. Just wanted to quickly touch on a lot of speakers have mentioned anthropomorphized cartoon characters, animals, gummy bears, Doritos, products that look like existing non-cannabis products. Long story short, those are all hemp. Our cannabis regulations by the DCC ban all of that. That is not legal cannabis products. And I can tell, not going to name names, I can tell a lot of the people commenting haven't read the entirety of the DCC regulations, let alone the specific sections they're commenting on. And I strongly encourage everyone to read those DCC regulations and see what they say, because there are actually really strong protections around marketing to kids, stronger than I've seen in any other state in the country. The hemp issue, though, that's federal. That's a federal issue. You want something done about hemp marketing, you need to contact your congressperson. You need to contact the FDA, the USDA. They're the ones who are handling hemp. So it just, you know, I'm glad these are being brought up here, but it's disingenuous to go to the CAC when they're not the ones who are setting the tone for this. One other thing about these hemp operators that are pretending to be existing brands, these are the shadiest of the shady operators. They're using low quality hemp. They're trying to capitalize on existing brands' IP. It's blatantly illegal, but someone was talking about enforcement earlier. You know who we need for enforcement? That's the feds. The feds enforce hemp. They enforce the hemp market. That is not California's purview. Like by law, by the supremacy clause, it's a federal thing. So go to the FDA, go to the USDA, contact your federal representative about this hemp issue, because a lot of people on the cannabis side would agree we need to clean up that hemp market. That hemp market is a problem for everybody, for our kids, for the business industry, for good actors, for the environment. The hemp industry needs to be cleaned up. So please contact your congressperson, the USDA, the FDA, people who can do something about the hemp issue. Thank you.
Thank you. All right. It looks like we have no more commenters on agenda item number 5, and that would mean we can adjourn the meeting. Should we adjourn?
Yes, I think we're good to go.
All right. Thank you, everybody.